We will give the committee, when we go, if this committee wants to see me in the camera, the data that I will share with you, you will be shocked by some of the private facilities. And every day you have seen me, I engage all the stakeholders. But as I have said earlier, reforms is mandatory. The dignity of Kenyan patients is mandatory. We will make sure, and KEMSA will do a presentation, we will make sure drugs will be available. We will make sure there will be no quacks. But let me say it, those who created facilities because they used to siphon money from NHIF, you either close or you provide the right service and you'll be paid the right amount of money. And it's not me saying, the system, the digital health transformation will pick that facility. It's better to have in a county 20 health facilities that comply with the law than have 100 that are formed by crooks and people who want to defraud the social health authority. So the DHA, the Kenya, the SHA, DHA, and the regulators, both even the Clinical Council, they have so far done 983 non-compliant health facilities, 487 of them. Chair, I'd like to give this committee an example, 2 examples only. 2 examples. We have cases where there's serious double claims. One person is going to 5 facilities in one day. We have clear evidence, and we'll give to this committee, where outpatients have been turned into inpatients. Somebody goes to hospital just to donate blood, then is admitted for 5 days. The kind of fraud that is going on in private, faith-based, and sometimes public facilities. Sometimes even in my own referral. My own referral hospitals, like my own. I'm not also clean, but I'm cleaning my referrals. I have talked to the CEO of Kenyatta Hospital this morning. I told him your license allows you 18,000 beds. 1,800 beds. 1,800. You'll only admit 1,800. If you want to admit more, go buy the beds. Get the space. There's no way Kenyans will sleep on the floor and 2 other Kenyans will be on a bed. They don't know each other. They have the same disease. And then we talk about the dignity of the patient. That will not happen under my watch as the CS. And this committee, I want you to support me. On 4 key areas. On the operation of Social Health Authority, the operation of Digital Health Agency, how we are reforming and increasing the fill rate of KEMSA from 51% to 90% by putting more money, both government and the private sector. The issue of how we have dealt with perennial healthcare workforce dispute, and I want to thank the committee for giving us enough resources, including UHC, which we are going to turn them into permanent and pensionable after we do a countrywide audit, which has started today. Both my PS and the CEO of Council of Governors have begun this morning. And thirdly, I am ready to answer to the issues raised on bed capacity, why we are closing fraudulent, fake, ghost facilities, mainly in private and faith-based, mainly in the private, in fact. And finally, give update on the registration of SHA, both those who will access the primary health care, those who will access SHIF, that is the insurance part of it, and how we are going to deal with the matter of emergency chronic illness fund, which Parliament has given us money, And of course, with the Council of Governors, KEMSA is both our baby, because we are supplying drugs to the last mile, facilities owned by the councils of governors, like our county leaders. And secondly, on the National Equipment Program, which again, we work in collaboration with counties on the matter of fee for service, where the national government is not paying for the equipment, the county government is not paying for the equipment, the Kenya citizens are not paying for, but that vendor and supplier will be paid for his CT scan, for his dialysis machine by SHA, based on the number of citizens who use that facility. So we have not finished. KEMSA has not presented yet, and Kenya Medical Practitioners and Dentists Council, our regulator, has not presented. So that's all I can say.
The issues that are arising, and I know the three issues that are of concern to the public now is the issue of registration, which earlier on was going on and with the monthly installments, and now is coming as lump sum. And they have given us the information on why this is so and what they are planning to do, which they are going to give us in our next sitting. And we are keen that whatever happens, we must make it possible for members of the public to pay, if by installment in some way that is manageable to them. And that is what we are going to next. In the issues of facilities that are now not working, they have explained to us the issues that to deal with issues of fraud that they are concerned with. We have had those. There are some that may be acceptable, some not, and we are going to also get full information and the way forward in this matter. There are issues of availability of drugs in the health facilities that we have not touched. KEMSA is going to give us a presentation in the next session in the afternoon. We know that in the budget we have put money for the implementation of primary health care and also emergency and chronic illness fund. And this is they are going to tell us exactly in the afternoon how this money is be utilized, so that in level 2, level 3 and outpatient in level 4, people can get treatment without paying as is expected, because money is now available. How that will happen.